All right, I believe we can get started. Good evening, everyone. Welcome to the Bloodline series, April edition. My name is Miri Olani, and I'll be your moderator for today. Over the past sessions, we have explored different aspects of blood donation, from the science to lesson learned from organizing blood drives, and how we can turn Nigerian spectators to voluntary blood donors. Today, we'll be focusing on an important topic: are hospitals selling donated blood? Are hospitals selling donated blood? We'll be talking about the reality, the system failures. So there are a lot of different opinions and questions around this. So tonight, we will talk about what people believe, what is actually true, and where the system may have challenges. Feel free to stay engaged and drop your questions or opinions in the chat box as we go along. Now, I am pleased to welcome our guest speaker for today. We are honored to have with us Ms. Precious Yaro, a medical laboratory scientist and also sexual and reproductive health rights advocate. So I will take a moment to briefly introduce her. So Yaro Precious is a medical laboratory scientist, sexual and reproductive health rights advocate who is passionate about public health awareness. Beyond the laboratory, she uses digital storytelling to educate and also engage on issues such as obstetrics, fistula, gender-based violence, child early and forced marriage, and also family planning. She is committed to bridging the gap between science and society by making health information accessible, relatable, and also impactful. So at this point, I hand over to you, Ma. Miss Precious Yao, to take us through today's sessions. You are welcome, Ma.
All right. Thank you so much, Mary. Good evening, everyone. Um, it's nice to be here. I don't know, since I was told about this session, I've been so excited about it, and that is because for the past 1 month, it has been something that has been coming across. I have been coming across, and there's really a need to talk about it. Our hospitals selling donated blood. So it's going to be a very interactive section. We're going to be using our chat boxes. I would love to hear your opinions, your thoughts, and we will learn together. The essence of this all is that at the end of this session, if we have myth that hospitals are selling donated blood, we'll know what is the realities and we'll see where the systems are failing, if actually hospitals are selling blood or not. So feel free, engage in the chat box. We would have conversations as we go. And I trust that by the end of this session, we'll be living here with a different mindset entirely about donated blood, whether it is sold or not. So thank you so much, everybody. And I just know that we're going to have an amazing time together. As introduced, my name is Yaro Precious Gimbia. I'm a med lab scientist, a serving corper right now. And will I say, fortunately for me, I'm currently in hematology unit. So, and I'm currently on blood bank bench, transfusion bench. So it's more or less I'm coming to discuss what I've been doing for the past 1 month. So I know that we're going to be having an amazing session. Yeah, so let's get right into it. This evening we'll be looking at hospitals selling donated blood. What are the myths? What are the realities and system failures? And how can we address some of the system failures? Next slide, please. So we have an outline for this session, and I believe that we'll be able to run through all of it before my time elapses. So we'll be looking at introduction. We're having a little bit of icebreakers to set the mood for the conversations, and then we'll be understanding blood donation. We can't talk about whether hospitals are selling blood or not if we don't talk about blood donation itself. We'll talk about some of the common myths, the realities, the system failures, what is obtainable outside Nigeria in other places, and we'll also look at solutions, and we'll do a call to action. We will make commitment as we go on changes we want to see in our own healthcare system, and then we'll conclude and we'll call it a night. Yeah, so let's go. Next slide, please. So this is a question. I would want us to use the chat box, but if you want to speak, you can just indicate with a raise of hand, and I will just call quickly. Please, let's go back to the icebreaker. So the first one, if you donate blood for free, should anyone ever have to pay to use it? Now, this is a question I would want a response. We can use our chat box, please. If you donate blood for free, should anyone ever have to pay to use it? Should anyone ever have to pay to use it? I want to believe that we have people who have donated blood or are donating blood. So Patience Blessing said no. Anybody else? Yes. If you donate blood for free, should anyone ever have to use it? And this is the whole essence of this conversation. What happens to the donated blood that is given? Why do people have to pay for, or do people really have to pay? So okay, Mary said no. Faith say give it to someone who needs it urgently. Okay, thank you so much for the responses. We have no, give it to someone who needs it. Yes, let's go on. So we would actually at the end of this session know whether the blood should be given for free or someone has to pay for it. So blood donation is one of the most powerful acts of humanity as it saves millions of lives every year. We have need for blood, people having need for blood every day, be it accident victims, be it childbirth complications, be it people having anemia. We have a whole lot of need for blood, and blood donation is one of the most powerful acts of humanity. It saves millions of lives every year. It is voluntary, it is selfless, and it is meant to ensure that no patient dies due to lack of blood. We've had scenarios where people die because there is no blood available to be transfused. Many people donate with the belief that their blood will be freely available to those in need. But is that really our reality now? Many people donate with the mindset, and just like I asked, a lot of people say no, blood donated should be given freely. But is that really what is obtainable in our healthcare facilities in Nigeria right now? Let's go. We'll find out whether that is what is obtainable or not. Yes, let's go. Next slide, please. Sorry, I'm so sorry. The network just threw me out. But I'm back. Sorry, everyone. So let's quickly discuss. Let me see your response in the chat box. Have you or someone you know ever been asked to pay for a unit of blood? Have you or someone you know ever been asked to pay for a unit of blood in the hospital? And how much did you pay for a unit of blood? Let me see our responses in the chat box, please. Have you been asked to pay? Yes, patient says she has been asked to pay for blood but didn't pay. Okay. Faith said no to both questions. Any other response? Please let's engage in the chat box. Any other response? Have you or someone you know ever been asked to pay for a unit of blood, and how much did you pay for that unit of blood? Yes. Let me see our response in the chat box, please. I've gotten only two responses. Faith said nope to both questions. Patient said yes, I've been asked to pay for blood but didn't pay. Okay. Bolu Atife said no. Mary said nope. Oh wow, it seems like people have not had need to get transfused, or someone you know get transfused. So where I am, I'm currently in Kaduna, and the facility I'm currently in, a pint of blood is, I don't want to use the word sold. A pint of, for you to get a pint of blood, that's 1 unit of blood. you are paying 12,000 naira. In other facilities, you pay 10,000 naira from morning to afternoon. Once it's evening, you pay 15,000 naira. Yes, so when you go, they will tell you, they will check the request form, how many units do you need. So if you are, take for instance, the doctor requests for 4 units of blood. That's about 24, that's 48,000 naira a person will pay for 4 units of blood. And if you are going to get it outside that facility, you might spend, some facilities spend and sell as much as 20,000 naira. Yes, some sell as high as 20,000 naira. And it's either you pay and get, or you go elsewhere. Yeah, so let's go to the next slide. Next slide, please. Okay, now understanding blood donation. Now we've just talked about the fact that people have been asked to pay for units of blood, but it's important we understand the types of blood donation we have. And we basically have 3 majorly. The first one being voluntarily unpaid donors. These are people who just walk into the healthcare facility, to the lab, and voluntarily, the word without being paid, would say they are here to donate blood, and then they give a unit of blood without being paid any money. They give freely, to be given to anybody. We have the family replacement donor, and this is more common, where if you have a sick person or you have a sick relative, they would ask, and he needs to be transfused, they will ask that you bring people to come and donate. Even with that, you still pay. So you get family replacement, you pay for the services, and then you bring someone to donate to replace. And then we have paid donors, and this is highly discouraged, because for some people who do this, it's like a profession, it's like a business. They are on standby. If you happen to be in the hospital and you need blood, and you don't have a family replacement donor to come and give, and there's no blood that is from a voluntary donor, they have their numbers. They'll just call them and they will bring people to come and donate, and you pay them there and then, and they go. That's like their own work. They come, donate, collect money, and then they go. So we have 3 types of donors: the voluntary unpaid, the replacement donors, and then the paid donors. And it is highly discouraged, because ideally you are supposed to donate after 3 months. But some of these people, because it is like their profession, if you are not careful to ask questions, some of them will even lie to you and tell you they've not donated for like 3 months, and whereas they just donated like maybe a month or 2 ago. And that's why it's discouraged, because you cannot even tell how truthful they are. Some of them, because that's where they get money from, so some of them can give blood, and that's how crazy it is. Yeah, so next slide. So now we have an understanding of blood donation. We have basically 3 types of donor. Yes, next slide, please. Now, what are the common myths around blood donation, voluntary blood donation? And the most common one that I've heard is hospitals are selling donated blood for profit. Before I address this, I want us to respond to this question. Are hospitals made for profit? Do we run hospitals for profit? That's the question. So we can respond in the chat box. Do we run hospitals for profit or for humanity services? Do we run hospitals for profit or for humanity services? Please, let's respond in the chat box. Are hospitals run for profit or for humanity services? Are we here? Are we here? Please, let's use our chat box. Are hospitals run for profit or for? Okay, Mary says she thinks both. Okay. Any other response? I think both. Okay. Any other response? Okay, so I also agree with Mary. I think both hospitals are run for both profit and for human services. And reason being that if some of these services are not charged, how does the hospital get to keep running?
Now, the myth is hospitals are selling donated blood for profit. And the fact is, blood are not sold. Patients are just charged for the cost of services. Now, for every unit of blood that is being donated, it goes through series of processes to ensure its safety before being transfused to an individual. So, like the question I asked earlier, when you donate blood, should it be given freely? If we say yes, it should be given freely, who pays for the services that is being rendered, or who pays for some of the procedures that are done on this blood to ensure its safety? The government or the hospital run at loss? And we would say that hospital is for profit, which is true, because hospitals are meant to generate profit. So if it is given freely and some of these screenings are done freely, how does the hospital get money to run? Are selling donated blood for profit? That is not true. Patients are just charged for the cost of the for your blood will be used. I've seen people who say they will not donate freely. They have to know somebody before they. Donated blood is stored and used for any patient in need based on compatibility. You do not need to know anybody before you donate. You can just go and donate voluntarily. You don't need to know the patient. Some people have said they have to know, it has to be their relatives or it has to be someone they know, but you do not need to know the person to donate. Another myth is blood donation is only needed during emergency. But the reality is blood is needed every day because we have emergencies every day. We have emergency surgeries that come up. We have childbirth complications that come up that women bleed, and there's a need for transfusion. We have people who are anemic and they need transfusion. We have people who are on chemotherapy. We have people who are on dialysis and they need transfusion. So every day we have need for blood. So if you have the mindset that you only donate in cases of emergency, then allow me to tell you that there are emergencies every day. Accidents happens literally every day, and some people die because they don't have. You go to a facility and they don't have the required blood in the bank, and so you see that people die because there is no blood in the bank. So you don't need to wait for emergencies for you to donate. Blood is needed every day. Let's go to the next slide, please. Yeah, so now that we've clarified all of this myth, the next thing we'll look at, next slide please. The next thing is, if blood is donated freely, why do patients still need to pay? Now, this is where the whole of this conversation is, the fact that blood is donated freely. So why are patients asked to pay? And I will walk us through some of the things or the reasons why patients have to pay for blood that is donated, even though the person who donates it give it freely, but the person who is receiving it has to pay for it. Let's go to the next slide, please. Yes, next slide, please. So this is the reality. For every unit of blood that is collected, the patients pay for testing. Now, before the bleeding is fully done, about 4 to 5 mils of the blood sample is collected. And when it is collected, what is done is hepatitis B screening, hepatitis C screening, HIV, VDRL, that's a test for syphilis. Blood grouping is done with that little volume of blood that is collected. And this analysis that I've mentioned make use of consumables. They are reagents that are used for this testing. So if you don't pay, if you don't ask patients to pay, how does the hospital recuperate that money? Now, after the testing and you're sure that the patient is medically fit, there is no hepatitis, there is no HIV, there is no syphilis, you proceed to bleeding the patient. Now, when you bleed the unit of blood, you take it to the blood bank. Now, blood banks are not cheap. The bank itself, the fridge itself is not cheap. It requires money to be bought, and it requires maintenance as well. Now, storage is there. From storage, we have transportation, and that depends on if it is in that facility that it is used, or it has to be taken to another facility. It has to be transported. Now, lab services, beyond the first test stage that has been done, further analysis are done. We have ELISA to check for hepatitis B, for hepatitis C, for HIV. Now, so you can see that there are laboratory analysis that are done on this blood to ensure its safety. It wouldn't make sense that blood is given freely and you give that patient an unsafe blood. The essence is that the patient gets transfused with a safe blood. So lab services you pay for. So part of what the patient is paying is for testing, is paying for storage, is paying for transportation, is paying for lab service. Even the human services, we have people who do this analysis, the lab scientists, the lab technicians. We have people who do this analysis and they need to be paid. So it is not for the blood itself, it is for the services that is done on the blood. So the payment is not for the blood, it is for the services that is rendered on the blood. And that is where the reality is. As much as people think that blood is sold, this is where the misconception comes from. The fact that they are charged for services. But the challenge is people don't get a clear explanation of what they are paying for. 2 weeks ago, I was in the donor bay and I was sitting down. I was just on my phone, and two patient relatives came to donate. And they were having a conversation. What was the conversation? They were saying blood is being sold. And one was like, that's why he cannot be a donor. He cannot be a voluntary donor, because even if he gives it freely, they will say it's free, but they will still make the person that they are giving the blood to pay. And I had to quickly tell them, sorry, can I join your conversation? And they said yes. And I had to quickly explain all of this to them. And they were like, oh, now they understand that nobody has ever bothered explaining what they are paying for. They know that when they come to the lab, they will tell them, the doctor requested for 2 pints of blood, you are paying so amount, and that is all. Sometimes if the facility don't have, they will tell them, go to another facility and go and buy and come. And when you buy from another facility and come, you still have to pay, I think, about, depending on the facility, but where I am, you still have to pay like 4,000 naira again for them to do cross matching in their own facility. So take, for instance, you go and buy blood 15,000 naira outside. When you bring it to the facility where I am, you pay 4,000, that's 19,000 naira for 1 unit of blood. So all their mindset has been, they are paying for blood. So why do they need to donate when, even when they donate, people still pay for it? And I had to explain that what you are paying for is services and not the blood. And that made more sense to them. And they were like, oh, now they understand and they are willing to become voluntary donors. So please, let's go to the next slide. So you see that a lot of people don't have the awareness that they are not paying for the blood itself, they are paying for the services. And it boils down to the fact that there is no proper explanation. Next slide, please. There is no proper explanation that this is what you're paying for. You are not paying for the blood itself. And so people are like, if I'm paying this large amount, why will I now come and give my blood freely? Now, the whole essence of that payment is to make sure that the blood is safe. So from collection to testing to component separation, some facilities separate their whole blood into various components, to plasma, to the red cells and all, and then the storage, and then the cross matching itself. So all of these steps are done to ensure that the blood is safe. Like I said earlier, it wouldn't make sense that it's more or less, I gave you something for free and it is damaged, but you are giving the person a damaged good because it is free. And so what the lab is doing is to ensure that blood they are giving is safe for the patient. That we don't give you a contaminated blood and you come back, you came to the hospital with another condition, you are living with another condition. And that is why you are making payment to ensure that the blood is safe. Next slide, please. So that is the essence of that payment, to make sure that the blood is safe. So now this is where we are having the challenge, the system failures. We are having a whole lot of system failures, and that is what is affecting people's mindset about
All right, it seems we are having a slight network issue. Please bear with us. She should be back shortly.
so sorry, my network threw me out again. So as I was saying, the first one is weak infrastructure, and I was trying to talk about the fact that while I was interning, there was a day that we left the unit and went, and then we came back in the morning and the fridge was at 16 degrees. Now ideally the fridge is supposed to be between the temperature of 2 to 6 degrees Celsius, and we came and met it at 16. And the challenge was the fact that there was no light, and the facility couldn't afford to install solar that would be able to take the fridge. So we were just dependent on NEPA light. So if NEPA brings light, fine. If it does not, so all of these things are factors that compromises some of this system. The fact that we are having poor documentation. Some people donate, and I know that ideally there's supposed to be a card for you as a voluntary donor. Some don't even have, they can't remember the last time they went to donate blood. And we have shortage of staff. You go to some facilities and they are short staffed. People are stressed. So we are having poor infrastructure, as weak infrastructure, as one of the system failures. We're having poor funding. If our government, where ideally the government is supposed to be either subsidize or take up a little bit of the burden, but we are not having that. So the hospital is left to have to source out their money out from the patient, because they are buying sample containers, they are buying syringes, they are buying blood bags, they are buying everything they need for these services. And if they don't have fundings, they obviously have to find a way to generate money to get that. The facility I am, in fact, their own is so bad that they privatize the unit to I think an individual and an organization. So they are splitting the profit 70-30. The private organization is having 70% of the profit, the hospital is having 30%. So, and the organization is just focused on profit and not even about patients. So they are inflating prices of things, and it just feels like the only thing they are concerned about at this point is profit. Let's make profit, let's make profit. And there's no concern about the fact that life is hard for people. People are managing. You're coming to the hospital, you know that you are definitely going to have lots of bills to pay. So if government have had subsidized or taken a bit of the burden, I know that ideally government used to give overhead to government owned hospitals, but sometimes the overhead don't even come on time. When they come, they are not sufficient for the hospital to use that money given to them to run the hospital. So it's overburdened on the patient. The hospital needs to generate money to be able to pay for the government to pay the staff. So a chunk of the financial responsibility is now shifted to the patient, and so we have poor funding as one of the system failures. Another one is over reliance on family donors. For the past 3 weeks in my facility, we don't have any blood from voluntary donors. All the blood in the fridge were replacement donors, were from replacement donors. So when you go, you see every blood having tags. They have owners. In fact, some go to buy outside and bring. So we just keep, we're like storage. We just come and keep it for them. When they are ready to do whatever procedure that brought them to the hospital, they'll come and collect it and they go. And so for the past 3 weeks, we don't have any blood from any voluntary donor. And even when we have the voluntary donors coming, we don't have some consumables for us to run some of this screening. So we don't even collect the blood. And it's a challenge. Another one is lack of centralized system. I talked about some of the facilities selling blood as high as 20,000 naira. There's no centralized system of, if we are going to be selling units of blood, this is the exact amount it is going to be sold. So every facility is left to sell at the price they want to. Some sell 10,000 naira. In fact, a particular facility, from morning to afternoon, they sell at 10,000 naira. Once it's evening, they sell at 15,000 naira. So the question I've been asking is, did the services change from morning, afternoon to evening? The extra money that is added, whose pocket does it go to? The person rendering the services or the hospital? And it is because we don't have a centralized system that is fixed that for this blood screening, this is the exact amount that is supposed to be collected, or give a range. So every facility is left to do what they want. And so patients are being extorted. People are being extorted. And of course, you expect when they require blood, is always emergency. So at this point, patient relative don't have any choice. They want to save the lives of their loved ones. So they go and they pay any amount just to save the lives of their loved ones. So you see that we really, really need voluntary donors, and we need a centralized system to cut up some of these exploitations that patients face. Let's go to the next slide, please. So these are some of the system failures we are facing in Nigeria. Weak infrastructure, poor funding. Now, what are the patient's challenges? Delays in access. There are times you have your money, there are no blood in the bank. What happens? You have the money, but the blood is not available. And most of these issues are from people who have had to travel from their community or where they stay to another place to access healthcare. When they come, they don't have relatives there to donate. So in cases like that, and there is no voluntary donor, they get delay in access. While some of them, they are blood from voluntary donors, but they don't have the money to pay. The blood is available, but they cannot afford the amount that is being fixed. Another is pressure to find donors. For some people who have some particular type of blood group, say for instance, people who are O negative, getting compatible donors used to be a challenge. And so most times, even when they are blood that are O negative, they mostly don't give to you. Are sure you have someone to replace. So there's always this pressure to find a donor. You begin to call, and sometimes you have the donors, but they are not fit. They come and they screen them, and they discover that some of them are not fit to donate, and it becomes a challenge for the patient relative. Another is high fees. Like I said, imagine going to buy blood 15,000 naira outside. You are coming to pay 4,000 naira for cross matching, and that's 19,000 naira. You are going. So imagine you are going to take like four units. That's a whole lot of money. So patients are challenged with high fees. I think 2 weeks ago, a father came that he wanted to donate for his 4-year-old child, and we told him we're out of ELISA kits for HIV, so we could not bleed, and we don't have blood to give him. And so we were like, he should go and buy outside. And he was like, why will he go and buy outside? Is the one going to donate? We said, even if we collect it, we don't have, and we don't know the day they will be making supply. So if we give somebody's blood to you and the patient comes to look for it, how do? We don't have any other one to replace. And it was a serious problem. The man was not having it. He asked how much are they selling. We told him price range, and he screamed. He was like, that high? We said yes. He now said, is he paying anything when he comes back? We said yes. And the man, you can see the frustration. You can see the tiredness, but then he wants to save his baby. So he's at the point of, is either you pay and go and buy outside, or you are left with, that's like the only option you have. So these are some of the challenges that patients are facing. Another one is possible informal payment. The truth of the matter is, we have corrupt people even in the laboratory. Some people some people extort money from patients. Yes. So somebody can tell you what ideally you're supposed to pay 12,000 naira. They'll say they want to help you, and they might just add maybe 1,000 or 2,000. Or some people tell you, let me help you. They will now collect the money and remove their share and remit whatever they want to remit to back to the hospital. So possible informal payment. And some people, because they need help, they don't mind. They can pay as high as you mentioned, and just for them to get that unit of blood that they need. So these are some of the challenges that patients are facing in the facilities where they go to get healthcare services. Yes, next slide, please. I think we need to speed up. Yes, please, next slide. Now, ethical concern. Please go to the next slide. Ethical concern. The first one is equity. And this is where the bulk of the issue is. The wealthy people have the money to pay, so they can pay any amount to get blood, while the poor ones are left to struggle. And there are times you come and they are begging to help, for you to help them. But if you decide to do that, how do the hospital recuperate its money? So when fees are high, low income patient may be delayed or denied access. Sometimes the blood is there, but they don't have the money. Now, is it fair that survival depends on ability to pay? And that's the issue. Blood are being donated freely, but then you can't get it till you pay. So is it fair that survival is dependent on your ability to pay? If you cannot pay, you allow your loved ones go. If you can pay, you pay and get the blood, and your loved ones get transfused. So this is where the issue of equity comes. If you are fixing price, do you consider the financial status of patient, or you just fix to get your profit back? The next one is transparency. Many hospitals do not clearly explain. Like I said, a lot of people don't donate because they don't know what they are paying for. They feel like you are selling the blood to them. So what are the charges for covering? Why payment is required? Nobody explains it to them. And this leads to mistrust, because a lot of people now think that they are buying blood. And the assumption is that blood is being sold. So anytime you go, they say, you can, even if you don't have donor, just go and buy. So people think that they are buying blood, so there's no point for them to donate voluntarily. And patients deserve clear, honest communication, especially in critical moments. The truth of the matter, some of us who work in the lab can be very rude. Patients are coming with their overwhelming challenge. They just need you. Some of them can actually be annoying. Some of them can, because of how stressed they are, they come and it feels like they are transferring their aggression on you. But they need to understand what they are paying for. If you don't explain clearly, they mistrust you. Some weeks back, there was a challenge. A patient relative came. They had a patient who was on chemotherapy, and they came to confirm that their blood was available, and they were told yes. And she called her husband. The husband was like, "Oh, these people have not sold our blood." And well, like, this is the mindset people have, that people in the lab sell people's blood to other people. And it just didn't sit well with us. And we were like, we need to create awareness to people that we don't sell blood. What they are paying for is the services. Next slide, please. What they are paying for is the services. So we need to be transparent, even in our places of work, in the lab. People need to know that this is what they are paying for every time they pay. Accountability. Who is responsible for regulating the system? Now, we have national blood transfusion services, I think, in almost every state in Nigeria. But is there a centralized system? Who regulates it? Who checkmates how much hospitals are charging for payment of services? Nobody. Every hospital is left to decide what amount they want to. And so you can see that in a locality, 3 hospitals are giving out units of blood at different amounts. And for some of them, it might be the same consumable they are using. but they are charging differently. Now, weak oversight can lead to overcharging, informal, or in fact, we are having a lot of illegal payments. People collect money less than and they pocket it, they don't remit it to the hospitals. Mismanagement of blood supply. Some people abuse, some people waste consumables, and that is because there's no system that is checkmating some of these things. Now, regulatory bodies like NBTS should ensure fair pricing and ethical practices. They are supposed to ensure that there's fair price of units of blood for people who are buying. Now, if no one is held accountable, patients are vulnerable to exploitation. And that is why people keep saying the blood bank as the lab is selling blood, because people are exploited. Some sell as high as 20,000 naira. So imagine that you're buying somewhere 10,000, you now go to another place and they tell you 20,000 naira. That's like times two. That's times two of what you're buying. And that 20,000 naira is enough for you to buy 2 units. But because there's no regulation, you can buy in a place with 20,000 naira, you're buying 2 units. In another place with 20,000 naira, you're buying just 1 unit. And so you can see that exploitation are happening because there's nobody to be held accountable. Yes, next slide, please. Next slide, please. So after accountability, the next one is exploitation. Just like I said, patients are often in desperate situation. You don't expect that a man comes, his wife is booked for emergency C-section, and he will stay and be negotiating. They will agree at any cost. They will feel pressure to do whatever it takes to save the life of their loved one. So at that point, they don't care how much, as long as they can afford it, they pay. And that gives room for exploitation. So charging unclear or excessive fees during emergency can take advantage of fear and urgency. Because it's urgent, you don't need to think about the fact that these people are charging me more than what it is. But because you are at that point of fear and urgency, you pay any amount just to get that unit of blood to save your loved one. So another challenge is the exploitation, and we see it every day. We see it every day. Next slide, please. We see it every day. The next one is trust. The next one is trust. Now, trust is everything in healthcare. For every patient you attend to, it is because they trust you. Now, when people believe blood is being sold, systems are unfair. It leads to fear. It leads to reduced willingness to donate. And that's what we're facing. A lot of people do not donate because they don't trust the hospital. They just believe that blood are sold. So they don't trust that they give freely, it will be given freely. And a broken trust system can cost lives, not just reputation. I think whenever I had conversations with some people recently, and when I told them where I was, and they're like, the people's hospital that used to sell blood. And I was like, is this bad? And they're like, who does not know them? And I was like, oh my God. They will tell you the different prices they've bought unit to. So you sorry, I'm back. Mary, please, how many minutes do I have left? So
10
we can
minutes.
see that a broken 10
10
minutes.
minutes.
Okay, thank you. Okay, thank you. So we can see that a broken trust system can cost lives, not just reputation. There are here in Canada, there are facilities that when you call their name and you talk about and you connect them with before you finish, people have already screamed that place, and it has just left a stench on the reputation of the hospital. It has left a stench that these people sell blood and they don't even tell you that they fix price, like they have varying price. So if it depends on the time you go, the time you go will determine the amount you get. So next slide, please. So we can see that trust is a key factor in healthcare system. Now, what is obtainable in other places? Global best practice, voluntary donation system. They have a
donation system.
very so he please can you mute?
So
Now
he please
they have
can you mute?
now
They have
so he please kindly mute your mic.
your mic.
Farami, please can you mute him from your own end, please?
You can continue, ma. Mhm. You can continue, ma.
Okay, I'm back. Sorry, the network threw me out. So some of the global best practice are voluntary donation system. They have people who give voluntarily, and it's not just a one-time donation. They are frequent donors. They give after three months, and they have government fundings. So the government takes up some of the burdens of the fees that patients are asked to pay, and they have strong regulations. The prices does not fluctuate like the way we have it in Nigeria here. And there's public awareness. People are aware of what they are paying for every unit of blood they are paying for. Let's go to the next slide, please. Next slide, please. So we've talked about some of uh some of the challenges that patients
Since we're having network issue, so while we wait, you can drop our questions in the chat box. Thank you. We are still trying to reconnect. Thank you for your patience. So when we wait for Miss Precious, please, if you have any question, can we signify any question? Okay, your question, Toyib, is that why is it that the hospital requests for 2 blood donors in place of a pint of blood being used for such a patient? Well, I think Miss Precious we answered that, but you guys can drop your questions while we wait for Miss Precious. Thank you very much.
Okay, I think okay, I'm back. Sorry, it went on my
Welcome
own
back.
end. Thank you. It went on my own end. It's been making the network go crazy. So we've talked at some of looked at some of the challenges. Let's look at the solutions. What do we do? Increase donation. Now, when we talk about increased donation, we need to talk about encouraging people to come and donate voluntarily, because we can't keep relying on relative replacement. And why that is because there are times where accident emergency comes, and it is blood that we get from voluntary donations that we give those people to stabilize them. We have people who relatives come, patients come and they die in the process of healthcare services, and at that point will you be asking them to bring donors to come and family to come and replace, or you'll be sympathizing with them, even though we ask them to, but we allow them to mourn, and then after that they can come with relatives to come out, but we cannot fully rely on family relatives for donation. We need to increase awareness for voluntary donation. We improve funding. If the government can really look into subsidizing prices of these consumables, or taking up a bit of the burden of the facilities, it would help improve transparency in pricing. Can we have a standardized price? Can we have a centralized price for how much you are paying for these services? And let's have strengthened regulation. Let's have people that come to check to ensure that this is in order, that this pricing is in order. Public education, let's create awareness to people. This is what you're paying for. You're not, when you donate voluntarily, you are not selling the blood. You are paying for the services. And emergency blood policies. Can we make exceptions that there are cases where patient come, you can give them blood without having to wait for them to bring relatives before you do? I know of a facility that they have a emergency blood policies. When they have emergency like this, the doctor comes and sign a loan form saying they give consent that blood should be loaned to patients. When they are stabilized, their relatives will come and replace, and it has been working. So can we encourage that we have more of emergency blood policies to help save lives first before considering the money or getting a replacement? Yes, next slide please. Next slide please. So we've looked at the solutions. Now, what can each and every one of us do? What we can do is to become voluntary donors. Call to action. Let's donate blood. If you're here and you've not donated before, or you donated once, can we make it a thing? And that is why Bloodline is here. Bloodline is here to ensure that nobody dies as a result of lack of blood or inaccessibility to blood. And that is what Bloodline is about. Can we make it that after every 3 months we go to give 1 unit of blood? If all of us can do that, we'll be amazed at the number of lives we can save by giving voluntary donations of blood to the hospital. Let's educate others. Let it not just end with you. Educate others. When you hear people having conversations that hospitals sell blood, enlighten them. A lot of them are not enlightened. Enlighten them. Educate others. Spread the word. We're not selling. What we are doing is asking you to pay for the services that is being done on this blood. Our goal is to ensure that you are being transfused safe blood, and we can't do that without you paying for these services. Let's support better healthcare policies. Let's come up with better healthcare policies. Let's push for implementation of better healthcare policies that would help in saving lives, in ensuring that we have available voluntary blood donated in the hospital. Yes, next slide please. So if you give a unit of blood, what you are doing is saving a life. There's always someone who is your blood group. You're not the only one having your particular blood group. There's always someone who has your blood group, and you donating that unit of blood will go a long way in saving life. Let's go to the conclusion please. Will go a long way in saving the life of someone. They can be accident victims, people who are traveling to another place and they get involved in an accident. Your unit of blood can save those lives. It can be a mother trying to give birth to her child and she's a serious complication. Your blood can save. So give blood. You have someone who is your blood type. You definitely have someone. So in conclusion, hospitals should not sell blood, but the system failures make patients bear the cost. And that is the real issue. The system failures is what is making patients bear the cost. Sometimes the biggest barrier to saving lives is not lack of donors but misinformation. A lot of people, if you had to do a survey, you'll be shocked to find out that a lot of people believe that hospitals sell blood, so they don't see the need to donate their blood. So it's misinformation, and we need to debunk, we need to create awareness about this. Blood donation is built on trust. Trust that a free gift will be used to save lives, not create barriers. So for anyone who works to donate a blood, they are giving it from a place of trust that the hospital will use it well. And that is the essence of voluntary blood donation, that you are saving a life. So thank you so much everyone for listening. So sorry that we had to be going back and forth because of the network. Thank you so much. So let's have our questions. If you have any questions, please.
Ma, there is a question in the chat box.
Seem to find that, I think it went off because I just came back. So please,
Okay.
if you can read that for me, maybe please.
Okay. Ma, there is a question in the chat box, ma.
Yeah, I can't seem to access that. I just came back, so it's not showing on my own end. So
Okay.
if you
He
can read it
said,
from your end for me.
okay, he said, why is it that the hospital requests for 2 blood donors in place of a pint of blood being used for such a patient?
Okay, sometimes why they do that is that when you bring two people, the screen, before they collect the unit, they would screen them to see who is fit before they take. So it's possible for you to bring one person and is not fit. You begin to go and look for. So sometimes the second person you're coming with is like a backup. If the first person doesn't pass the screening, the first person doesn't pass the screening, the second person should be able to. And there are times that you will be surprised that you can bring two donors and both of them do not fit. We have had cases like that you can bring and both the two donors you brought are not fit. You would still have to go and look for other people to donate, and that's another challenge. And it also depends, if the doctor requests for 2 units of blood, you definitely have to bring 2 people to donate. So sometimes it is to save you the stress of having to go back and forth looking for donors, so that you just bring 2 at once. They screen the first one. If it's fit, fine. Then the second one can go. If it's not, then the second one can also be screened. And sometimes it is based on the unit of blood that you are required to use. I don't know if I've answered that question.
Yes, ma. Thank you so much for your response. Okay, we have another question here, ma. So, can a O negative female with PCV of 32 donate blood?
Okay, whenever a female comes to donate, we often have questions we ask. So the first thing we would ask is we always check weight. We would ask when was the last time you saw your period as well, to be sure that you did not just finish your period and you are coming to donate a unit of blood, because we don't want to collect and give you back. There are times that you can bleed a patient, and then because they become very easy, you give it back. So PCV of 32. Now that depends. For females, the normal range, we have what we call a normal range. It is a range of a minimum and a maximum that that's the pack cell volume is supposed to be within. Now for the females, it is within 36 to 46. But it also varies. Some will tell you, some facilities have varying values, and location also matters, have varying values. But between 36 to 46, below that they wouldn't want to, because it might be risky for the person. So there are factors to consider. For females, most of the times they would always check your weight. They would ask if you just finished menstruating, and they will also check your PCV. If your PCV is below the normal range of that place, they wouldn't take blood from you. I don't know if I've answered that.
Yes, ma. So, do you still have any
Yes, and maybe
question?
there's a question. They said if it's possible we can get the slide. And if you can share the slides with them for those who joined late.
Okay, ma. Okay, ma. Do we still have any question? Any question, any opinion? Do we still have any question? Okay. So since there are no more questions from the audience, we'll be stopping here for today. So thank you to our speaker, Miss Precious, for taking the time to be with us, and also thank you to everyone who joined and participated. Okay, I think I saw one question here. Okay, it's the same question. So we hope these sessions has helped clear some doubts and also give better understanding. So we'll be stopping here for today. Have a great day. Bye. Thank you, ma.
You're welcome. Thank you, Mary.
Yes, ma.